afternoon, good evening. It is a pleasure to have so many people with us to share this webinar for the PMAC 2021. First of all, I want to share the objectives of this particular webinar. We want to identify and describe forms of resistance in terms of enforced extraterritorial obligations, government policies, social movements. How may they be supported? How can we support social movements? And what have been the opportunities and the threats? The other objective is to identify and discuss policy proposals to address social exclusion of different levels, calling upon the conference participants to adopt. So those are the objectives of this particular session. Now, in this session, we want you, the participants, to use the question and answer function to put up any questions that you might have. And you can place those in other languages, in Spanish, in French, in Arabic, if you wish, and we will answer them during the question and answer period. I want to introduce the moderator for this session. Dr. Hani Sareg is the former coordinator of the People's Health Movement. And he's presently at the University of Texas in Galveston, where he is a professor. Dr. Hani? Good day, Dr. Hani.
Thank you. Thank you very much, Maria. I'm very happy to be with all of us. And as Maria said, please share any questions you have in the Q&A and we'll direct them to the pertinent speaker. Thank you very much, Maria.
Thank you, Hani. Now I want to get underway and introduce to you our first panelist. Her name is Victoria Gass. She's a policy person from Oxfam, America. She lives in Washington, D.C., and she's going to share with us the impact of COVID-19 in Central America, which is her particular area of interest. It's great to see you here.
Thank you, Maria. It's a pleasure to be here, and thank you to the PMAC conference for inviting me here today. I am going to start with my presentation, and I'm going to share my screen. Just give me a moment. So, good morning, good afternoon, and good evening, everyone. I am going to talk about vulnerability in COVID-19 in Central America, the causes and the role of civil society. So people in Central America will say to you that COVID-19 is not the only pandemic hitting the region. There are other pandemics that have been equally devastating and harmful to people. And I'm going to talk a little bit about some of those pandemics. The first one is poverty and inequality. Latin America continues to be the most unequal region in the world. And this is especially true in Central America, where you have poverty rates, people living at the poverty level or below the poverty level of between 40 and 60%, depending on which country you're in. A second problem is the corruption and impunity. Corruption and impunity in Central America is rampant. There are crimes that have committed, such as the assassination of Berta Cáceres in Honduras in 2016. Here we are 4 years later, and although the intellectual author is in jail, his defense team is continuing to put up obstacles for the trial to continue and justice to be done. There are regressive tax policies, and this applies not only to the wealthy and political elite in Central America, but also international investors in the country. So in Central America, in El Salvador, Guatemala, and Honduras, you have the majority of taxes coming from indirect taxes, which falls primarily on the poor majority. This is the consumption tax. But you also have tax incentives to foreign companies. For instance, in Honduras, there are between 11 and 19 in tax incentives. So they don't pay taxes, and they don't pay utilities, and they don't pay water and electricity. And it means that, once again, it's the people of these countries that are footing the bill for this. The other area is climate change. In all of Central America, especially in the dry corridor, you've had consecutive years of drought, 5 to 6 years, which is causing hunger and starvation for many of these people, and also forcing them to move into the cities or outside the country. Gender inequality is just as bad in Central America as it is around the world. And especially with COVID-19, there's been an uptick in violence against women and young girls. And finally, the economic model, which is based on extractives. And it's not only just metallic mining, but it's also other industries, agro industry, African palm, and others. Let's see if I can move this. So this is the vulnerability that came up before the pandemic. And now we're going to see what the pandemic is doing and the impact that it's having in the region. So what we're seeing in Central America is that there's an increase in poverty. So the modest gains that were made in the last 20 years are being quickly eroded. And there's a massive increase of poverty, especially in countries like Guatemala, El Salvador, and Honduras. Internal and external debt payments of these countries are increasing. In El Salvador, it's up to 90% of the GDP will have to go to pay external debt to institutions such as the World Bank or the Inter-American Development Bank or the Central Bank of Central America. And this is due because money is coming in. People, the international financial institutions are providing support to these countries, which is desperately needed, but it also means that internal and external debt payments are increasing. And so in Honduras, for instance, their debt has increased. I heard yesterday over 300%, and that's more than what they had before entering HIPC, the program for highly indebted poor countries. There's an uptick in gender-based violence. People are being forced to stay in their homes. They're hungry. They're desperate, and that causes tension and violence. We also have an increase in opportunities for corruption because of the flow of aid to Central America, to the Central American countries. For example, using Honduras again, a company called Invest H or Invest H contracted for 5 mobile hospitals to be distributed throughout the country in order to respond to the pandemic. 2 have arrived. They don't work. They don't function. 2 or more are expected to arrive, and the anticipation is that they also won't function. Fortunately, in this case, the owners, the CEOs of Invest H are being investigated for corruption, and that's unusual. We're seeing an increase in human rights violations, in part because people are going out trying to get food. They're violating orders to stay in home. But again, if you have to eat, and many people work in the informal sector, they have to go out, they have to find food. And yet they're being repressed by police and military forces. We're also seeing an increase of closure of civil society space of people who are trying to speak out against the corruption and the impunity that has long been there, but is increasing under COVID-19. And we're also seeing a move towards greater authoritarianism in all countries as attacks on the press and human rights organizations are increasing. And these are people who are being critical of the governments for their response to the pandemic. And finally, we're seeing all of this is contributing to forced migration. These are factors that have always pushed people to look for better lives elsewhere. And just a couple of weeks ago, a caravan left Honduras trying to get to the US border with Mexico. They were turned back in Guatemala and forced to go home. But we anticipate as desperation increases that this type of forced migration will continue. So the question becomes, what can civil society do? First is the humanitarian assistance. Organizations like Oxfam are providing water, hygiene kits, and food to people who are unable to people who don't have food and access to water. We also are working with civil society organizations on advocating for policies that can help improve the situation. The first is social protection. It's a form of cash transfer. It's looking at people living in poverty and below the poverty line and forcing the government to try to provide them these monthly stipends. It's the ongoing battle for fiscal reform, so those tax incentives aren't there, and so those people with more means also pay their fair share in taxes. It's calling for advocating for oversight and transparency of the aid that's coming from bilateral donors and from the international financial institutions. It's working with women in providing care to shelters and financial aid to shelters. So women who need to escape abusive situations can do that. And it's promoting laws that support rural development for small to medium producers in the region. It's a long haul. Really what this pandemic has done is just reveal the weaknesses in these countries and the importance of advocating for better policies and a new world. Thank you.
Thank you very much, Vicki. It was really important for us to see what's happening in this region of the world where I'm living, and we thank Oxfam America for all they're doing to help the people of this region. And now we'll go to the other side of the world, to India, where our next participant, panelist, is Sarojini Narimapalli. She is a feminist activist and the director of SAMA, which is a resource center for women, for the women's movement. Sarojini, thank you very much for being with us today.
Okay. Am I audible and visible? And the PPT
Yes.
is okay? Okay, thank you. Sorry, it took some time. One is getting used to this technology. Yeah, I think I'm going to rush because many of the things which Vicki has shared are very much, similar to what we are experiencing in India. I'm just going to talk about the impact of COVID. I'm going to talk about the challenges and the strategies, which I think which is very important for today's presentation and how to move forward, and also talking about certain initiatives which are, I feel, to some extent, a positive way of looking forward in these bleak times. The situation, I'm sure most of you are familiar, and the cases have been increased. But besides the COVID pandemic, that is one situation. We have COVID pandemic, but there are other critical realities, that have been brought consequences. Consequences of the responses, that is a sudden and severe authoritarian lockdown, which happened immediately in March end. And this has led to a humanitarian catastrophe at an unprecedented level, and it has a long-term and devastating impact particularly on the marginalized and vulnerable communities. So it has heightened the inequalities sustained by the structures of gender, sexuality, disability, religion, ethnicity, work, location, and it has led to stigma, discrimination, mainly against the Muslim communities and also to some extent on transgender communities. And there is a lack of access to determinants of health due to the structural intersecting inequalities which is related to food or other essential goods and services. And there is an increased risk of gender-based violence in the home and beyond. And sexual harassment, sexual violence and harassment in quarantine centers, in prisons, in isolation wards, even within the ambulances, which we have come across. And there is a weak and poorly resourced health system, and which is already grappling with inadequate budgets and infrastructure, and also inadequate infrastructure and the shortage of the equipment, whether it can be ventilators or the PPEs, and skewed patient doctor or health worker ratio, amongst several other shortfalls in skilled and adequate healthcare workers. That is a situation which was already there. It has been much more in the COVID situation we could see. And there is a lack of strong gender responsive health systems, violations of the rights of the health workforce, particularly the frontline health workers and also the sanitary workers. The exclusive focus on the COVID-19 crisis impacting and impacted also on the access to non-COVID healthcare seekers. And wide-ranging economic impact, economic insecurities, unavailability of work, unemployment, lack of wages, unjust anti-people, anti-women labor laws which came in that increased, exploiting the gendered work, domestic workers, women farmers, or as micro entrepreneurs. So this is a situation where I'm, locating my presentation. There is inequity in accessing to technology and information. We know we live in a patriarchal society. Women have very little access to the smartphones, and it is also casteist. And ableism I brought in because you don't use any other you don't acknowledge the people living with disability, and everything is in written words. So it is very, very difficult for people with disabilities to access any information and technology. There is a concern about surveillance, health data, and the mandatory documents. We have this COVID tracking app, and now they are proposing the unique biometrics, unique ID for administering the future vaccines which are breaching the privacy and confidentiality. And also the health rights. I just want to focus a little bit on the migrant workers, which is very, very important. It will be incomplete, unfair if I don't talk about what the plight of the migrant workers. It is an illustrative of the prevalent inequity and injustice. Several workers were stranded without work and wages when the lockdown was imposed. The situation was dire for the migrant workers. We saw the mass, I don't want to use the word exodus, the caravan was much better actually of migrant workers in the months during midsummer, traveling thousands of kilometers on foot in soaring heat. You can see the picture here. They left cities in huge numbers during lockdown due to loss of livelihoods without work or wages, relief or financial support, which was initially supported by the NGOs, and the fear of being infected, uncertainty on the duration, nature of the lockdown, and lack of any support system. I really, like the illustration itself speaks a lot from the Food Sovereignty Alliance. And there are incidents of migrant workers sprayed with hazardous disinfectants amid fears their exodus is spreading the virus. And there is an apathy and delay in responding to the migrant crisis that caused many deaths. You can see the numbers here. And I would like to flag one which actually shook the entire country. And it is the migrants who died on the railway tracks, who were sleeping, walking, they were tired, they slept on the track because the railway tracks are the directions which take you to your hometown. This is the picture I just wanted to say. One example which happened in May, where 16 migrants workers were run over by the train. So this is something which an illustrator has. I thought it is very, very powerful. It speaks to us. It actually makes us to think about where exactly we are locating the informal labor That is very, very important. From there, I would like to move on to the, things can happen if there is a political will. Things can be changed if there is that kind of focus. Dharavi, which is the one of the largest slum in Mumbai city, is a home to about 8.5 million people, cramped quarters within a 2.5 square kilometer area. But they could, bring down the curve, flatten the curve, because the Bombay Municipal Corporation, they carried out the screening despite facing the the heat and the fainting due to the PPEs all the time. They faced several challenges in Dharavi, but its approach to tackle the virus they used for tracing, tracking, testing, and treating, and the proactive timely screening, isolating by the civic bodies with the assistance of the private doctors and the community. That support helped in the fight against the disease. So the significant initiative, why I want to say, besides the Kerala experiment experience, but this is very, very important. This is an urban slum and where the migrants are coming or leaving. And this significant initiative, the opportunity to sustain the momentum for access to healthcare, addressing the social and economic inequities that Dharavi continues to grapple. And that is something which we should look up to, which I thought very important. Uh, the state accountability, which I want to bring in here, and the why the political will matter.
2 minutes, Sarojini, 2 minutes.
I'm finished. They have responded with a number of welfare measures, advisories, guidelines to address the impact of COVID. We have almost 160 advisories, even for the migrant workers. And there are advisories which are focusing on the regulation of the private sector. Despite this, there are repeated instances of the private sectors, private hospitals flouting the government orders. And the implementation at the ground level of these advisories and the schemes is a big question. At the ground level, we still get to know the violations happening, and we can see the fall in the immunization and the maternal mortality, the increase in the maternal mortality rates, and despite all the essential services guidelines which were there on paper. And there is a significant documents, but the absence of implementation, that actually violates the human rights. In conclusion, despite COVID-19, exemplifying that to struggle with this and other pandemics, the issues implies a struggle for equity and justice. I think that is a fundamental message which I would like to communicate here. Lack of substantive policies measure to address the serious socio-economic impact, especially on the marginalized and vulnerable. It may go business as usual after some point of time. But that has something which we need to look into. The continued diminishing of the public health system, the absence of the resourcing transformative policies, continued push for privatization, which is also happening. The rigid global national economic structures that dictate access to goods, including medicines, tomorrow maybe COVID vaccines. So inadequate steps to address persisting violation of the rights of the health workers, particularly the frontline and sanitation workers, their safety, their regularization is very, very important. So I conclude, the pandemic has exposed the very deep fractures in societies that we must reckon with. It's a moment that is challenging us to create and bring in a systemic change. And we need urgent and sustained solidarities across the movements, peoples, to resist, to challenge, to transform, to emphasize on redistributive justice, to ask for the accountability from both state and non-state actors. Struggles are not new for all of us who are in the people's health movements and social movements and women's movements, but the pandemic poses another critical moment to us to reinforce and to forge ahead. Thank you very much.
Thank you, Sarojini. It's really dramatic to see the situation. I especially found it impacting to think about the slum in Mumbai that has a population that's greater than our countries in Central America, in some of our countries. So it's pretty dramatic. Thank you very much for your wonderful presentation. And now I would like to introduce our next panelist, Dr. Alexis Benoit. He is from Greece, from the University of Thessalonia, and where he's a professor of public health. Thank you very much for being with us, Alexis.
Okay, thank you very much. Hello to all. Thank you for inviting me in this very interesting discussion, which actually has a really an international form, because I can say that after the first two speakers, I can just say the same things. I mean, which is not just a weakness of mine, possibly, okay, but I think it is very important to understand that the problems are global and the situation is global also. So we have to act also internationally. So just some points. First of all, speaking again for before the pandemic period, I have to remind that we were already in a big economic systemic crisis. The global debt in the first trimester of 2020 was the global debt, 255 trillions of US dollars, which means 3 times more higher than the global GDP. In Eurozone, where I am coming from, the stagnation was here from 2018. From 2016, which has something to do with the elections coming up in USA, we have the trade wars produced by the USA government and growing trends of protectionism. And of course, all over the world, all this period before COVID, we have a growing inequalities and poverty. In Greece, it's the same. The 10 last years before COVID, we were under European inspection of austerity policies, 10 years, which has led to, especially regarding the public health system, its dismantlement, underfunding, understaffing. The human resources are aging because they are not replaced. We had and we still have the lower rate of intensive care unit beds in Europe, and of course a lot of privatization. Actually, also before COVID, we had within the highest rates in Europe of family bankruptcy because of health care reasons. So this is one part. The other part, which is also before in Greece, is the refugees and immigrants issue, which is actually considered both from the national government in Greece, but also the European Union authorities, that the refugees issue is a security issue. So the main policies that they are making here in Greece, but also with the auspices and the pressure by the European Union, is actually the pushback policies. We have everyday pushback of refugees with a lot of victims, of course, and they are trying to keep low that in the media and to hide it. Secondly, we have a lot of hotspots, which are actually concentration camps in our view, overpopulated, lack of the minimum requested conditions for health. And now we go to the COVID situation, where continuing for the refugees, the refugees population were the first that were locked down in the camps before the general population, and they are still under lockdown measures. So the refugees, actually the Prime Minister said that, are considered as the main problem and the main agent of giving us COVID transmission in the Greek population. So you can understand that we have a lot of right-wing and fascist actually movement and ideas around. So the hotspots are in quarantine, no isolation of the cases, no protection of the vulnerable people, no tracing, no testing criteria, and so on, so on. The same goes for all vulnerable populations, which means the elderly, the prisons, and so on and so on. And the main approach of the government is that the crisis, again, the COVID crisis, I mean, is an issue of security, and it is also a problem of personal responsibility. So they are stressing on the responsibility of the refugees, as I said, the responsibility of the youth, the young people that are around in the plazas and drinking beers and so on, and denying and neglecting any social determinants of the COVID transmission, which actually in Greece, but I think it's also international. First of all, are the working conditions. We have the biggest outbreaks here are outbreaks in big factories, okay? And of course, they're neglecting the situation of the public transport, which is not, helps to have better conditions. So also regarding the economic measures, only the funding, the government is funding the banks and the private sector of the health sector, but not the people working. So we have a degradation of working conditions. Work is not even right, of course, today, not only Greece, all over the world, and of have growing poverty and inequalities in the country. So the main, in terms of public health, which is also our issue, I think, we have also internationally the same trends, which is in Greece, we have total inconsistency of the policy of the government in terms of public health and epidemiology, lack of surveillance, lack of tracing, lack of data recording, lack of transparency. We don't know how many cases we have every day, how many tracing tests we have done. We don't know the geographic distribution. We know nothing. The health system, of course, is under strain because, as I said, we have also a very low number of intensive care units beds. And another issue which already has been said by Sarojini, I think, is that also here in this country, the non-COVID morbidity is completely neglected. So we have a lot of people, a lot of deaths also, and of course, deterioration of a lot of chronic cases with chronic diseases that are really neglected this period. On the other side, and again, I think this also is international, the pandemic crisis is used as an opportunity for expanding corporate interests, for funding friendly media, for funding private health sector, and philanthropo-capitalism, which is the only sector that now is paying something for the health system. I mean, we have a lot of donations. In parallel, we have an important regression of the democratic rules. The parliament is not working because, as it is all the law of the urgency, they are neglecting even the parliament. So what is our duty and where is our work? I mean, regarding the global—
2 minutes, Alexei, 2
Yes.
minutes.
Okay, the international movement. So the first issue is the solidarity and the movement against all this. Here in Greece, we have, for example, a very interesting and very positive leading role of the Federation of the physicians working in the public health system, which are leading the movement for the public health system. We have very important anti-racist mobilizations regarding the refugee problem and so on. And we have recently also a very interesting and very big anti-fascist movement regarding and related to the, probably the fascist movement that was last week condemned in all the leadership of the fascist movement were condemned in 10 years of and even more of imprisonment. So we have a movement. And on the other side, we had during, especially the lockdown, we had a very interesting campaign, which was called No One Alone, which was the only and very big solidarity movement, solidarity to vulnerable people, but also solidarity in all kind of needs that were around. So my final point I want to say is that we have, I mean, this is an opportunity for us and for the global movement to stop all these. And first of all, questioning first of all, the globalized intensive for-profit agro corporate complex, okay, because this was the cause of the virus, and this will be the second and the third and the next generation of viruses if it's not stopped. We have to see the working conditions of the people working, and of course we have to urge the needs for a public health system in order to deal with that, where of course all people, including refugees, have to be integrated in the society, in the local society. So generally we have to struggle and not let the poor people pay the bill, pay the burden, which is already here. I mean, the inequalities are growing because the poor people are paying both economically, socially, but also as patients and deaths. We know that all over the world, we have very important inequalities regarding morbidity and mortality by COVID. So my point is that we have to see and to struggle to make a new international movement, struggling for health as a social right, and putting health in the top of our political agenda globally. So asking to change the agro, to change the for-profit economy to an economy regarding and targeting the needs of the population. Thanks.
Thank you very much, Alexis. Thank you very much. You brought out some really tremendously important points in your presentation. Now we will go to our last presentation. Just a minute. Our last panelist is in Amman, Jordan. Dr. Akiro Seita is the Director of Health for UNRWA, and he will be talking about the refugee camps and what's happening with COVID in the refugee camps. Thank you, Dr. Akiro.
Thank you very much. Good morning, good afternoon, good evening for everyone. My name is Seita. I'm the Director of Health of UNRWA. It's the United Nations Relief and Works Agency for Palestine refugees. As everybody mentioned, allow me to go back to pre-COVID, because it's always so important to remember that how the world looked like in pre-COVID, particularly for Palestine refugees. And it was not good. In Gaza, there was a war in 2014. In Syria, long-standing conflict. This is a photo I took 2018. In Lebanon, we have a long-standing difficulties for Palestine refugees. And this is a refugee camp 2019. This is one of the worst refugee camps in UNRWA. So before COVID, the life of Palestine refugees are not always good, and it's not really good. So how's the health, which is my domain, how the health of Palestine refugees? This is heavily affected. And then that there was a pandemic of an NCD, which is non-communicable diseases. The graph shows the trend of the diabetes and hypertension for UNRWA, for Palestine refugees. In 2000, it was around 85,000. In 20 years, it reached 280,000, 3 times more, and it's continuously rising. It's before COVID. In the YNCD, there's a pandemic of poverty and a pandemic of unemployment, as everybody, previous speakers mentioned. In Lebanon, the photo shows that the Lebanese, our joint poverty survey with the American University of Beirut clearly said 74% of adults are poor, and 5% of them were extremely poor, and only 5.5% have health insurance. So this is a pre-COVID, and this was getting worse now. And in Gaza, on top of that, the poverty due to the long-standing blockade, 40% of adults had no job, and the 70% of youth has no job. So unemployment is also a problem. Under such a situation, people do not have access to healthy lifestyle or healthy life food, because such healthy lifestyle or food are very expensive in comparison to their income. And so that's the main reason that when the people get poor, they get more time to get NCD. And this is my first message to the audience, that in 21st century, NCD is the leading cause of death and the leading cause of suffering for refugees in many parts of the world. So what we did, UNRWA, we provide a primary care, through the 141 clinics, as shown on the right graph, in 5 different locations. We call it 5 different fields: Gaza, West Bank, Jordan, Lebanon, and Syria. And while we provide in primary care, we try to improve our quality and the management of information before the COVID. For the quality improvement, we introduce a family medicine approach. We call it family health team because it's a combination of a doctor, nurse, and midwife, one team, to provide a person-centered continuity of care. This is for the NCD. And also introduce WHO's MHGAP strategy for the mental health. These are almost all the health centers we have. And also that to improve the management of information based on evidence. Introduce electronic medical records, we call it e-health, and this covers all the health centers through the internet with one server. And this server contains 3.2 million patient records. It's a wealth of information. And to further improve, we introduced the International Classification of Disease 11, ICD-11 so-called. The new nomenclature for the disease pattern is from last month for all the health centers through the e-health. So we try to improve our quality and the management. And here comes the COVID. COVID came to this part of the world in early this year, around the end of February and March. We responded quickly because we learned that this is a huge pandemic. Develop a preparedness response plan as agency-wide, which means that all the departments, and also that issued a flash appeal with $23 million to respond from March to May. And they got quite good support from donors. Thank you so much. And for health-wise, we did 3 things. One is to work with the host government. Because we are primary care providers, we rely on the host government for the diagnosis and testing and the treatment of the COVID-19 infected people, refugees. Secondly, we really need to maintain life-saving primary care. NCD, as I said, we have 280,000 people who are receiving medication from us. So we deliver the medicine to the refugees' home whenever needed to make sure they will continue to have a life-saving care. At the same time, protect our staff and the patient at health centers, which are very crowded. So introduce full PPE and the infection prevention control based on WHO recommendations, and introduce triage system for the infected people, and also mental health and psychosocial support. That initial response was quite reasonably well. However, what is the situation now? So one day I went to the refugee camp in Jordan and visited our health center and met with a 19-year-old mother who was on the left side of the pink. Asked her, how are you and how's today? And she said, I'm very happy to bring my kid to vaccinations. Then I asked, how's your life? She said, my life is very difficult. My husband was a day labor on the construction site, but now he has no job last 3 months. Then I asked, how did you survive? Or how do you survive? She said, my husband's family is helping us. This is exactly what the COVID-19 meant to the refugees and the means to refugees. So now, the graph shows the trend of the COVID-19 in the host countries, which are Jordan, Lebanon, Syria, and Palestine. Because of our operation, we divide the West Bank and Gaza in statistics, but this is one state. Red is Lebanon. You can see that until July, these host countries managed to contain with a very strict movement and all the other interventions. But since July, it flared up. West Bank started to increase, which is orange, and then the Lebanon hit a huge increase, including after the huge bomb blast. And Jordan is now increasing very rapidly. So this is a major burden to the society, not only Palestinian refugees, but the entire community. So as of yesterday, we have around 190,000 cases in the host communities with 2,000 deaths. Among Palestinian refugees, we know that 16,000 or close to 17,000 cases are infected and 152 deaths. And number is on the rise. You can easily imagine for this epidemiological community transmissions. So it gave 4 pressures. One is health pressure. Of course, our services and the host government services are overwhelmed with this rapid increase. And education pressure. UNRWA runs, we run 700 schools with 500,000 students. How to continue the education while protecting the kids and the more important, equally important, the teachers is a big challenge. and the economic pressure. It goes without saying, as all the previous speaker mentioned. The COVID-19 made already vulnerable Palestinian refugees the most vulnerable. Cash assistance, as well as the community support, become so important. And last but not least, we have a big pressure because the number of people infected with COVID among the staff is increasing. It's now more than 600 people infected with COVID-19 because of the community transmission. That is also the biggest challenge to us. So I think the title of this session is Resistance, Opportunity, and Threat. So we have 3,000 staff in UNRWA Health Services, and each 5 different fields. I asked the chief, who is the head of each field of health, and I asked this, what do you think the resistance, opportunity, and threat to COVID to us? These are the answers, and I'm very happy to share with them. Resistance, they said, pre-COVID, our service was before COVID is quite resilient, and then we have lots of innovations. Say, for example, that our health centers, 141 health centers, in principle, never stop providing service from the beginning till now. I truly admire and respect that our staff who are working from the beginning till now for the COVID-19. They are wonderful people. And then also, we started the NCD application. Sorry for this, but this is the applications we have that that is now we started last month for the care of the NCD patient among Palestinian refugees. They can register themselves and they can get the information needed. Opportunities. Many of them said, new way of works, more partners, and the new normal could be new hope. We started telemedicines because that is new to us, but to avoid the congestion at the health centers, but ensure continuity of care. In country partnership, it's not only UNRWA, all the UN are working all together now, together with the host government, Ministry of Health, or all the ministries, and also civil societies. It's because that the COVID-19 is a national response. And the PMAC, thank you for inviting us. Without COVID, I don't think I'll be able to join this webinar. So I think one thing COVID did good is they brought me to this webinar. But threat is very serious. As previous speaker mentioned, COVID-19 revealed and exaggerated all vulnerable in the society, health, society, everything. So our primary health care is at risk because of the staph infection, but also because of many other issues in the COVID. And the more important, if not equally important, that all tertiary cares are under the pressure. And the community integrity or support to the community is important, and this is a threat. People in the community, they need to live. Either they die with COVID or they die with the poverty. They want to die with the poverty, not they die with COVID. That's a reality of it. And the hope for the Palestinian refugees under the current political environment, but also the COVID is diminishing. That is also important. So this is my last slide. They appeal to this forum, but also the international community. As you have seen that the UNRWA, we contribute to the health care of Palestinian refugees quite significantly since the start of the Palestinian refugee issues. In maternal and child health mortality is reduced and improved. And the NCD, we are addressing the via family medicine as well as the e-health. So it's contributing to the health gain. Also, our services are quite resilient. Primary health care, as I said, never stopped against the COVID-19 shock. And we still continue to provide the services. And also that we are the last resort to the support, in particular, for example, Lebanon. The Palestinian refugees heavily rely on the UNRWA service, now becoming Syria and Gaza always becoming like this. So that the maintaining UNRWA is critical for Palestinian refugees. COVID-19 shock to Palestinian refugees and the host government is very important to address. And also that the overall health needs for Palestinian refugees. Because the health needs of Palestinian refugees never diminish because of COVID. They simply exaggerated. And that is very important to remember. So that we issued a flash appeal from August to December 2020. And I'm really sorry to inform that only 5% of requested funds are funded by them. So my plea with appreciation to this forum, but also the international community, is to please continue to support Palestinian refugees, and please do not leave no Palestine behind and no vulnerable people behind. Thank you very much.
And thank you for that very dramatic presentation and your faith in the people. It's wonderful. Okay, now I want to go back to Dr. Hani, who is going to moderate the question and answer session. If you haven't placed your questions in the question and answer button, please do so because we would like to have a good discussion here. So adelante, go forward there, Hani.
Thank you very much, Maria. Just to say, we are also keen to have comments, not only questions. So please feel free to post your comments, your questions into the Q&A box. We have a very interesting question to Vicky and Sarojini to start with. Dr. Wiwat from Thailand is saying you talked about the negative consequences of the pandemic and asking if you can go back using the time machine, what could have been done to prevent these negative impacts? So from your point of view, what should have been done to avoid these negative impacts of the pandemic? Vicky?
Well, I'll go ahead and start, and thank you so much for that question. I think to a certain extent, many of the countries in Central America did try to prevent the spread of the contagion, largely through shutting down borders, having stay-at-home laws, and only allowing movement outside the homes for very short periods and only one person at a time. But this could not be done indefinitely because people had to go out. These countries are highly dependent on foreign trade and exports, and they had to open up their economies. So that would be the first response to that question. The second is, I think part of the message that all of us have put forward here today is that what COVID has done is to reveal that the fact that these governments have failed their citizens, and they were failing them before COVID-19, and COVID-19 has only made it worse. And so if you don't have hospitals or you don't have equipment in hospitals to provide basic health care to citizens in the northern community of El Salvador, such as Chalatenango, then prevention would have been really hard to do because the services weren't there to begin with. So that's why looking at sort of the larger issue of prevention of, changing laws, make governments work for the people, make healthcare systems work for the people, make economies work for the people, and not just foreign investors or a handful of wealthy elite. That sounds utopic maybe, or impossible, but as Alexis pointed out, it's this model that has brought on this crisis. And until we address that model, we are going to have the pandemics, and no amount of prevention will really change that.
Thank you very much, Vicky. Sarojini, would you like to add to this?
I completely endorse what Vicky said. Like, I think it's in my presentation, though, because of the time I couldn't, but there are many issues which talked about how do we address within the presentation itself. I think the most important thing is like today it can be COVID, tomorrow it can be some other pandemic, as Vicky said. But the most important, I put it in quotes, the opportunity lost, this was a time we would have been strengthened, invested much more on the public health system, and in-source the private sector and regulated, something we couldn't manage to do, though we know it is a collapsing health system. The GDP is very poor, 1.5%, the overall GDP on health in our own country. So the investment and bringing back the focus on the public health system to address any such pandemic, along with addressing the social determinants. It's not only the healthcare services, there are many other issues related to the situation. So unless we take both healthcare services and social determinants, we may not be able to, move further. Thanks, Annie.
Thank you very much. Another question from Fran Baum. Fran is our chair, co-chair of Steering Council of People's Health Movement. She's asking, another social issue highlighted by COVID has been the failure of privatized services, including aged care, contact tracing, and quarantine security services. Has this been evident in your country? So maybe we start with Alexis to address that.
Yes, thank you. Thank you, Fran. It's very important. In Greece, when COVID started, we had the historical moment that the National Association of Doctors, which is mainly presenting the private doctors working as private entrepreneurs, asked to their members to close down their surgeries because it is dangerous for them. So I mean, the private sector said, no, this is not our job. And the same goes for the private hospitals. So they denied any care for suspicious people that were possibly cases of COVID or whatever. So yes, it is a big failure in Greece too. So all the burden was on the public health system, of course, and the private sector was just sitting there. And what was even worse is that the government, instead of putting up new intensive care units in the public system, they said, okay, we are going to use the intensive care units of the private sector, not use them, but we are going to pay for them. So what they have done is in one night, in March, they doubled the rate, the premium that you have to pay. So the public services are paying double for one bed of intensive care unit in the private sector for non-COVID, of course, morbidity, okay? So yes, it was a big failure, and it is still a big failure. The private sector cannot, and this is, I think, a very important question that Fran is putting, because in order to deal with a pandemic as this is, you have, of course, to deal with having in mind and strategically to look at the protection of the public health of the population. So without having any economic and profit-making ideas or strategies. So it is by definition, I would say, that this is a public health issue. And that's why it is very important to speak about public health policies, public health also services. This is another case. I think it is internationally. For example, in the United States, Hani, you know that the CDC dismantled by the Trump administration. The same goes here. I mean, the public health services, especially the CDC-like and so on, they are dismantled and they cannot cope with that. So we have to stress that we have to give more weight to the public health services, both in epidemiologically speaking as public health, but also to the public health services, speaking about the hospitalization and so on. The private sector was nonsense.
Thank you very much. Dr. Sita, I would like to ask you the same question. We know that UNRWA is delivering especially secondary care through contracting both public and private sectors, and it's different from a place to another for your population. What's your experience dealing with public and private sector in different settings, different countries?
Yeah, sure. I think the country differs place by place, and also the health system differs by place by place. So we can never generalize anything. But from my point of view, that in this part of the world, that the public sector was the leading factor for the COVID. So whenever COVID came in, they diagnose and treat all in public hospitals. And it was okay at the beginning. And then that once, and then until the June and July, September, as I show in the graph, once it is escalated, it's impossible that the public sector alone can do diagnose and treat. And so they start engaging private sector. And then that there's an issue of quality, but they engage the better private sector for diagnosis. So private laboratories nowadays diagnose in PCR with the COVID, and also treating the patient in the private sector. Payment is a bit issue, but still it is expanding. So I think that it depends on the country, that the private sector is not always bad, and also the public sector is not always good. I think this is an opportunity COVID brought, that the different sector in the health start working together and addressing the needs of the community. I think that's I see it's quite a good sign in Jordan, Palestine, West Bank, as well as at Lebanon. And can I answer to the first question about what we're going to do if we go back? I think we should remember that, this is the vaccine. We do not have a treatment, no vaccines. This is a virus. We do not have any treatment at large. I think, staying away from other people and putting a mask and awareness, it is not the public, it is not the treatment. It's a mitigation only. And also we should remember that, say in Jordan, which I know the best, they did a very good until the June. We have only very few cases. And because of very strict, rigid movement, the airport was shut down completely for several months, and nobody came in. So we had no COVID in reality. But the community cannot survive with such activities. Say like the economies, say like taxi drivers lose the job. Many people lose the job, and the people cannot tolerate, and the government cannot continue this. Then once it's open this, then it's end of the story. I'm really sorry to say, but the end of the story. There's lots of economy movement, but also lots of waited wedding and the funeral. That's many dissemination places. So I think that's also important, that it is, say like in case of Thailand, when I see that the WHO curve, that they have a first wave very early in the outbreaks, and then they came down, so that the society is experienced to this. But after 3 months or 4 months of 0 cases, all of a sudden 100, 200,000 cases every day, I think it's very difficult to community respond. And then that's also the trust to the government is going down because of this continue to increase. I think that's also important part. But how to respond to COVID is a national capacity issue, the economy and the systems issue. Yep. Over.
Thank you. Thank you very much, Dr. Sita. Another question from Dr. Wiwet to Vicky directly. We understand that countries in Central America are facing the epidemic in different degrees of severity, and also incidence. What makes these differences? What are the determinants of these differences in Central America? And I would also like to ask Maria to comment if she has any further comments after Vicky.
Thank you again for that question. If you look at the news coverage of COVID in the region or other sources of COVID in the region, then you'll see that Guatemala is leading with up to 100,000 COVID cases, followed by Honduras, El Salvador, and then Nicaragua. So what does account for those differences? And I think I would ask the question of, are there really differences? So let me say, first of all, in Nicaragua, the Nicaraguan government of Daniel Ortega did not recognize COVID as a problem in his country up until just very recently, and has claimed a very low level of deaths in Nicaragua. And there's a whole host of reasons for that, which we could get onto in another conversation. And then you have the differences between El Salvador, Guatemala, and Honduras. And I think El Salvador was very much more strict in its containment for people coming into the country. For instance, they had to go up to a 30-day quarantine. Many were quarantined in very horrendous conditions, but some who were a little more fortunate, maybe had a little more resources, were quarantined in hotels. And then you look at Costa Rica, which has very low numbers, and that's partially due to policies and policies and a much better healthcare system, a public healthcare system that's not available in the other countries, And that's, you know, that's historical because they decided not to fund an army, but they decided to fund health and education, which is not true. So in Honduras, for instance, the military has a budget that is, you know, 8 times more than the public, the money budgeted for healthcare. I mean, it's 2% of the budget. It's just not much money. So we have to question and I guess the last thing I would say is that President Bukele in El Salvador, unhappy with the press coverage he was getting on his handling of the pandemic in that country, decided to open his own state media channel. So you have to ask, are there differences? Yes, but really? And I'll stop there.
Hanny, you asked for Hanny, you asked for my comments. What I can say is that the scientific committee that is dealing with COVID, which is an independent group of health professionals and education professionals, all of whom have been active in this country since the 80s and were part of the first Ministry of Health. They have conducted a study along with the people who are in this observatory that is being done by citizens. And a report will come out shortly that shows that there's 88% underreporting of cases of COVID in Nicaragua. They're not called COVID, they're called suspected pneumonias. And that's what they put on the death certificates. So it's a very contentious kind of issue to deal with here in this country. The other thing is that the government continues to have agglomerations of people, big public events all the time. And those are spreaders, of course, but they negate that there's really any problem here. The population does respond. There are many more people who are trying to use masks, but just as in the other countries of Central America, we have a very, very large informal economy, and the people have to find ways to feed themselves daily. And some people are eating only 1 meal a day here. So that's the situation in Nicaragua. Thank you for asking.
Thank you very much. A very challenging question from Claudio Schaften. He's saying that we had some of leaders of the world got affected by COVID-19, but they survived. So he's asking the panelists, if one of them or all of them did not survive, would we've been in the same situation or something could have changed? Anybody wants to answer? Alexis and Dr. Sita.
Yeah, it's a very interesting, wishful thoughts, Claudio. Yeah, I would, yes, I would be very happy if that happened. I don't know if this would change actually the situation we have here, because of course these are expressing specific realities in the world scene. I mean, I want to say that here because before I think Hira said that about the vaccines. I mean, it's not by chance, but that these leaders are pushing the vaccine gala, which is a nonsense, as you know. I mean, we don't have any evidence up to today that there would be a vaccine. And they started some months ago, and Boris Johnson and Trump, I don't remember if Bolsonaro did the same anyway. They started also betting and making a market on this, who is going to buy the vaccine which is coming and so on, which is a big bubble deregulating and taking the the intention of all the populations in the world, waiting the magic bullet of the vaccine instead of seeing what we are doing here, what we are doing now in order to protect our vulnerable people, in order to protect our immigrants and refugees, and in order to make a better altogether management of the epidemic. So, and the other issue also, which is very important, I think, here is that all these leaders are, of course, not even thinking about the impact of the epidemic, the pandemic, on the socioeconomic life of millions of people around the world. Okay, so no measures was taken in order to relieve or anyway to help all these people. The same goes from Greece, and the only thing that they are thinking is how the market is going on. For example, just a point from Greece is that the government, after the first wave, which was lower in Greece for several reasons, then they lifted any measures because in the sacrificing in the main big industry of the country, which is tourism. So after that, after the tourism opened, we had, of course, the new wave of COVID because of, for example, in all the planes, you know, this is international also, there are no measures. Everyone is sitting next to the other instead of keep distancing, for example. So the for-profit is here, and I'm afraid, Claudio, that it would be here even these awful guys would be dead.
Thank you very much, Alexis. Dr. Sita.
Thank you. I will say it quite differently. I really do not like this question. Being a doctor, I don't want nobody to die. I don't think we should wish anyone to die. I think that's exactly the hatred that the COVID is inducing in the world, and we should avoid such a discussion. If I have a personal opinion of the three leaders of the three countries, but it's up to them to either maintain next week or change. However, we should never wish somebody to die. I think that's the last thing as a human being to wish. And then as a doctor, I don't accept this kind of question. The question should be, is the three countries could be better place if they do it better? But it's not for the life of the three people, either whosoever, we should never wish somebody to die. I'm sorry, but I really do not like this question. I pause on my blunt point. Thank you.
Thank you very much, Dr. Sita. And of course, we do not have Claudia to respond, but we hear two different points of views. So thank you very much for it. There are another question, but I want to put it forward for the final responses from our panelists. So I would hope that in your final remarks, let's say 2 minutes, because we are we're having lots of short time after that. And I would like, before going to this, to ask Sarojini specifically. She's been working with her group on clinical trials regulations. And this is one of the things I would like to hear from her about the regulations of clinical trials on vaccines for COVID-19 in India. And I think this is important questions for lots of our developing countries as well. Sarojini, do you have comment on that? You're muted, Sarojini.
Okay. In response to the, some of the questions for all the panelists, I think it's very important sometimes to strengthen certain spaces which we are getting right now. For example, I just wanted to say that I'm right now appointed as the expert committee member by the National Human Rights Commission, which is an autonomous body in our country, and to look into the impact of the COVID on the vulnerable communities, I think that is where we have to step in, and then we have to give recommendations to the government. So if the National Human Rights Commission proposes the recommendations to the governments, they have to also follow them and implement. I think those spaces which we have to reclaim, and we need to think along with the communities who are affected, make them a part of the process. It's not coming from one survey or one something, and that is very, very important for me to highlight here. How do we move forward? The second point which you're talking, which I try to highlight a little bit in my presentation on the, if you look at it, the unique ID for the so-called vaccine whenever it comes up, which is extremely problematic proposition from the wherever it is coming from, that unless you have the unique ID biometric, which is not very common with the marginalized, particularly with the migrant vulnerable communities, they may not have this biometrics ID. So they will be deprived. So the equity issue comes very well when it comes to the distribution or access to vaccine. Coming back to the question on the clinical trials, like I did work quite a bit on the clinical trials, and then later on the access to medicines for the clinical trial. We have 33 now vaccine candidates, almost 33 to 34. There may be many more. We are now looking at them. I think by December our study will be out, like studying the from the clinical trial registry. The issue comes up right now is like every day you open, everywhere it is about vaccines and vaccines, and we have 3 which have been, almost they are saying they entered the phase 3 clinical trials. The issue is the approvals, and the safety, efficacy, 50% efficacy, what they are saying right now globally. What does it mean? What does it mean by, what about the rest of the 50% then? That is something which we need to ask. What is the science part of it? What are the ethics part of it? Along with the rights, this is very, very important even in the context of clinical trials. Approval processes, regulatory mechanisms, efficacy, safety, how ethically they have been conducted. Is there any system for the adverse event following immunization? All these are very important when we talk about vaccines. I thought, that is something we are trying to highlight in our own campaign from the People's Health Movement and from Sama.
Thank you very much, Sarojini. Before hand back to Maria, would be last round from our speakers, 1 or 2 minutes. I would like you to focus on what opportunities we have. So while addressing COVID-19 and hoping that the world is coming to be a better place after COVID-19, what opportunities we have to at least end with kind of optimistic view. But also there is a question from Dylan I would like you to consider in your final response, which is about militarization of the response. And from your experience from your own country, to which extent it was humane or more militarized. And final question was about Southeast Asia, if there is any focus maybe from Sarojini again on that. So if we start, maybe we start the opposite order. If we start with Dr. Sita and we have him to consider these different opportunities. Just before you start, Dr. Sita, I have to say that received a note from Claudio. He's clarifying that he never wished any of these leaders to die. He was asking a hypothetical question: if something happened, would we be in the same situation, or this would change the dynamics? So just to make this clarification. So Dr. Sita, floor is yours.
So Claudia, I saw your message. Sorry, I couldn't respond, but I agree. And I know I didn't mean that what you meant to say this. So apology if I take this one. But my honest feeling is what I said. And so for the Southeast Asia, sorry, I'm from Japan, but I don't have experience on the Southeast Asia now, so I cannot answer. The militarization, I think, end of the day, that the infection control, that say like what Jordan, Palestine, Israel did at early days, is that the total lockdown. And then in Jordan, they arrested many people who broke the lockdown. And if you call it a militarization, it's a militarization, but it worked well. But it didn't last. The point is that the Jordan government, their national debt is almost 100% of the GDP. And Palestine, you know, that's totally bankrupt. And Lebanon, I don't need to mention that they are totally bankrupt. So that's the reality of the country to respond. Opportunity, I think, seeing except Dr. Hane, other panel members I first time met and I really enjoyed, and it's really great. I think there's a huge opportunity. I feel that in the COVID era that we meet more people. There is a huge number of webinars and we communicate more. I had more friends in COVID through COVID. I never met them, but hopefully that we can meet physically in the next time and we discuss further, because I think it's a tremendous, wonderful session. Thank you very much. Over.
Thank you. Alexis?
Yes. First, the question about of Dylan about militarization. Yes, I said that before, that COVID is regarded by the Greek government as an external offensive, firstly allocated to the refugees. And now, for example, in these days that we have a re-emergence of the new wave, the problem is, by the government propaganda, I mean, is especially the young people who are drinking beers or anyway having a bit of fun in plazas, and not the working conditions, not the transport, the public transport conditions, and so on and so on. So yes, there is a militarization. Actually, in Greece also we have another issue that perhaps you know, that we have a tension in the area, the tension between Turkey and so on, and all the region here regarding the oil and that they're going to find in the sea anyway. So the government just made a decision to lock 10 billions of euros for arms, for weapons, and not a penny for the national health system. So this is the case. So about the opportunities, which is the final question, I think I'm not so optimistic. I mean, there are no opportunities. We have to make the opportunities with our struggles. I mean, the scene is here, and it's very clear, as all the speakers said, and we have all the common experiences all over the world. So the scene is here. All what is happening here with COVID is determined socially and economically by the system that is ruling, from the agro industry to what is happening today with the raising of inequalities and raising of poverty all over the world, means that we have to struggle against this system. We have to struggle against a system that is working with the for-profit power, and change that to another society, to another system, which is making public health and health generally on the top of the political agenda. So everything is going to be and the development and the economic activity and social activities in order to protect the health of all the population, and of course not only for a small fraction. So the idea is to change, and I think, I mean, it's okay, you can see it as an opportunity, but we are still, we have a long struggle to do, and we have, as it was said before also, we have to take this opportunity to raise our movements all over the world and to coordinate internationally, because we are not coordinated internationally. And thanks for this meeting also, that it's helping us. We have to coordinate all the forces that want to change this system, to change these problems that are only accentuated by the COVID pandemic.
Thank you very much. Sarojini?
I did speak about the opportunities in my previous comment, but what I would like to conclude is what Alexis said is it's very important to have this local and global solidarity, which is very, very critical for a just, equitable, and a healthy world. What forms can these take? That we need to think. that is in our hands. How do we take this forward? What kind of mechanisms, what kind of campaigns we would like to, strengthen, initiate, and then take it to the local communities. I think that is very, very important. Yes, the webinars are one opportunity, but in our own countries, in our own regions, and within our own movements, the convergence of the movements is equally important. There is a fragmentation at times. How do we, leave aside those differences and come and then work? Even if we have differences, we need to flesh out and look for the common goal, which is very, very important at this point of time. Thank you.
Thank you very
Thanks
much.
for the opportunity. Yeah.
Vicky?
Very quickly, just on the question of militarization, certainly in Central America, there was militarization, both in keeping people in homes and or keeping the borders closed. Not so much here in the United States, and there's a difference between federal and state responses, which I'd be happy to talk to you again. I have nothing to add to what Alexis and all my colleagues on this panel have said regarding the opportunities. Solidarity is an absolute must. We are more alike than we are different. And what this pandemic has revealed, this global pandemic, is the weakness in this system. And we need to be able to exploit that and talk to people about what is possible. It won't be easy, but we have to do it, and we have to do it together. Thank you so much.
Thank you very much. I will hand back to Maria to conclude the session, and thanks for everybody.
Thank you very much, Hani. Thank you very much to all the panelists. I'm supposed to make a summary, but I think you made the summary. I just want to say in Latin America, we talk a lot about the crisis of civilization. And I think that we have to recognize that we're living this crisis of civilization, and that we have to do something not only to save our people, but to save our planet. And if we recognize that the dominant model that we live today, including patriarchy, is really what is affecting us and is the cause of many of our illnesses, not just COVID-19, then there are things that we can do. I want to say that I really believe in solidarity and building the movement. And I want to call out to everybody to bring young people into this movement. We have seen young people reacting all around the world to injustices, not necessarily to COVID, but to injustices that are occurring in their societies related to racism, to sexism. And I think that we have to build the movement and make space for the young people to come and join us. So if there are any young people listening, please, please join the People's Health Movement, join your local solidarity groups. If you call it resistance, be in the resistance, be in something that fights against this dominant homogenic culture that is leading us to such destruction. But I want to say on a lighter note that I really appreciated being with all of you on this panel and working with you and working with our friends in Thailand. And I want to encourage everybody to share the information about this session with your friends, because it will be uploaded on the PMAC website. I don't know how soon, but it will be there so that people can share it with other people around the world and with your constituents in your different countries and regions. I also want to say that there is for the people who have participated an evaluation form that we want to encourage everybody to fill out. It's up on the site now, I think, up on the screen. So please, all of you participants, please fill out that form because it's very useful for us. And finally, I want to say that there will be another session tomorrow. Tomorrow's session, WS102, is communication during the health crisis. So we want to invite you all to take part in the next webinar and the other webinars that are being sponsored by PMAC. Thank you all very much. And thank you for the team in Bangkok for being so patient with us.